As Nigeria continues to explore ways of checking the spread of the coronavirus, medical experts continue to emphasize the importance of clean environment and everyday human practice that are capable of facilitating transmission. Joining us now from our RISE studio, Abuja, to have a very important discussion on this is Prof Bola Olayinka, infectious disease expert and family health specialist. She would also look at the task before Nigeria's education authorities regarding the safety of school children at this time. National Youth Service Corps members, COVID-19 outbreak testing and treatment, vaccines. Welcome to the program. We've got lots of issues to talk about this morning, Prof. It's a pleasure having you here. A lot of people are arguing, isn't it time to just shut down the education system owing to the fact that we are not testing enough? The numbers came out recently to say that since COVID-19 started, we declared the index case in Nigeria around March last year. We've only tested just a little over 1 million. In fact, 1,004,000 people have been tested in this country in a population that is estimated to be well over 200 million people. That aside, the high numbers of NYSC Corps members testing positive to COVID-19 and the high numbers across board, increasing numbers by the day. We're recording over 1,600 cases now every single day. Should we open those schools again in Lagos on the 18th of January? Or we should shut things down? Prof?
Yeah, good morning. It's true we have a lot of youth corpers testing positive, but I actually feel it's a reflection of what's happening in the society. If we were able to do community testing, we'll really find out that there are people who are positive in the community. Almost on a daily basis, I get calls from friends, classmates, with people who have suspected cases of COVID. Some go for testing, some don't go for testing. And then talking about the number of tests that have been done, it's complicated. Unfortunately, things are not usually always straightforward in Nigeria. Why is it that we are not doing enough tests? It's beyond even just the availability of the test. I think one is the willingness of people to go forward for testing. You find many people saying, oh, I have malaria, I have typhoid. Most of the time it's self-diagnosis. Or people will say, oh, because of the weather, I have what looks like a flu symptom. And unfortunately, those are the same symptoms of COVID. So we probably have a lot of people with COVID moving around. And of course, because they're moving around, going about their daily duties, they are spreading the infection. So when you talk about whether we should shut down the educational system, there's no straightforward answer. And I say this because it's not as if, okay, if we shut it down in 1 month, at the end of 1 month, COVID will be over. It looks like this disease is going to be with us for some time. And we have to devise ways of living even in the midst of COVID. And this is where the prevention measures really come into play. And I think the question we need to be asking as a country is, how do we enforce these prevention measures? Because at the end of the day, it's what we have. We're going to have to continue to live with COVID for a few months, or probably a year or more, as it is. And we need to survive as individuals, as a society, and as a nation. So how do we do this as safely as possible, and then at the same time reducing the transmission of COVID? I think these are the questions that we need to be asking.
Well, Prof, you are the expert, and that's precisely what we want to know. How do we prevent this scourge? What else does government need to do? I mean, government is engaged in communication, awareness campaigns. Only this morning, we were quoting the chairperson of the Presidential Task Force on COVID-19 saying that it's better to wear a mask than to go on a ventilator. But you see that Nigerians are just not listening. So what do we need to do to get them to listen? Sanctions? Penalties? At all levels? What do you recommend?
Okay, you mentioned sanctions and penalties, and I really think maybe this is where we might need to start. I go into many buildings, for instance, I'm required to wear a mask, but you find out that the person, the security at the gate, who is telling me to wear a mask, has a mask under his chin. You're going on the highway, you see the Federal Road Safety Corps people, and the mask is on their jaw or under their chin on the jaw. It's not covering the mouth and the nose. I actually think that if there's a way of implementing sanctions that even if you have a mask under your chin, it's not the same as wearing a mask and covering your mouth and your nose. If that is just one prevention measure that we can get all Nigerians to do, I believe that would actually reduce transmission. If you are saying that we need to shut down the country, I can tell you it's going to have very, very negative effects. Because when this was done in 2020, it wasn't effective because it happened maybe in the cities, but in the rural areas, life was as usual. But if we can implement the wearing of a mask, and wearing means covering your mouth and your nose at the same time, and if there are sanctions, penalties, if there's a way of enforcing this, but like I said, even the enforcers need to be exemplary. So I think maybe one of the reasons why Nigerians are a bit negative about this is because there are mixed messages. I mean, they watch people on television, they watch people in government, and they're not putting on the mask, even when they're in the midst of people. And then they're like, they are telling us to wear a mask, they are not wearing. So we need to, first of all, stop the mixed messages. Everybody needs to wear a mask. Whether you're in government, whether you are from presidency downwards, actually, everybody needs to wear a mask and needs to be seen to wear it properly. The second thing is, some people have the idea that a face shield replaces a mask. I think we need to debunk that, because a face shield does not contain viral particles from someone who is wearing it. So let's all go back to the basic mask. Let's enforce it. Enforcement may not be easy, but it might be the way to go. And when people find out that the enforcement is real and the enforcers themselves are exemplary in their behavior, I think it might be a step forward in the right direction.
Well, yesterday we were also told that according to disease surveillance that has been carried out so far, most of our cases are aged between 21 to 50. So most Nigerians presenting with COVID-19 are aged between 21 to 50. What does that mean for us as a country in our response to this second wave? And let me also ask you about let me allow you to answer that, and I'll ask you my other question later.
Okay, so what that means for us is that a lot of people who are positive and who are most probably transmitting to others are active people. They are the agile people, the active people, the workforce people, the people who move around, either in offices doing their business. And because we have people who are asymptomatic or mildly symptomatic, you could find out that somebody wakes up in the morning, feels a little under the weather, swallows 2 tablets of paracetamol, and moves around. Now, he or she is moving around doing the business, but is also at the same time spreading the viral particles to all the people he or she comes in contact with. And that increases transmission, it increases exposure, it increases the number of people infected. Now, if it was an older population, yes, the older population are more vulnerable. If they feel under the weather, they are more likely going to stay at home, which might be a form of self-quarantine or self-isolation. And so the rate of transmission might be lower. But when you have people between 21 and 50, you know, being the major people infected, those are not people that sit at home. Those are people that move around. And the virus particle is carried in the throats of people that are infected. And as they speak, as they laugh, as they talk, as they do their business, they're actually shedding the particles and sharing with others. And that means that we actually need to also target these particular people. These are the people who we need to enforce the use of masks. You also find out that these are the people who do not want to use a mask. You find out that the young people aged 21 to 30, they mingle with their mates, they're not using masks. In the evening, they're hanging out together, they're not using masks. And so transmission increases and transmission continues.
Right. Thank you so much for that insight as regards that. I want to talk about supplies in fighting coronavirus. There's a dearth of oxygen. Now we are ramping up oxygen supplies. There's also a dearth of PPE. There's also a dearth of face masks amongst, members of staff of NIMC. They went on strike because they said most of their members of staff are getting coronavirus, no protection. How can we get these supplies? And let me also add, there's also a dearth of testing. 1 million testing for over 200 million population is way too small. How can we get those supplies in? Is there a possibility we can ramp up our industries to provide these things here? Are we going to get to the stage where we can start making our own PPEs here?
I think one of the, I'm not sure the right word to use now, but I think maybe we have been a little myopic about things. A lot of effort was put on the immediate, but we also needed to have looked beyond the immediate response and look at it as a long-term thing. And when you're talking about health security, it's not just what do we do now when we have the problem. It's also looking at what we call preparedness for the future. So how do we work on this on the long term? I remember that there was a time the PTF had this committee regarding manufacturing of PPEs, and I know there was an indigenous company. I only got to know about one. I'm sure there were many, but this particular one has a Twitter handle, and they were providing, they were manufacturing masks, face masks. And that was a good thing, because coming out of this, when we had to import, there were challenges with importation, it was time for us to, to look inwards and see, why do we have to import something as basic as PPE? And I wouldn't know how well that manufacturing company had gone, because these were the kind of companies that government needed to support. A company may have started, but they would definitely have needed some support. And these were also the kind of companies that government needed to have, to have bought merchandise from, just like happens in developing countries. You put in some money into that company and you kind of commit to purchase from them so that they are able to produce enough to meet the country's need. So in terms of planning, in terms of forecasting and propositioning, our government needed to have liaised with indigenous companies who were making efforts, and then we could say, okay, we're able to provide or to produce face masks indigenously and would have enough for our healthcare workers. Now, when you talk about oxygen and ventilators, I think one of the challenges we had in the response, I do a lot of looking back. Of course, when COVID came, people did a lot of, they put in a lot of effort as best as they knew how to. But moving forward, it's important to learn from where we missed it so that we can address those gaps and we can improve on them. For example, there was a considerable resources put into setting up isolation centers. But at a point, we needed to have either moved those resources into fixed healthcare facilities. What do I mean by fixed healthcare facilities? Our teaching hospitals, our federal medical centers, our general hospitals. Because at the end of the day, those are the sustainable health structures within the system. And so now that we're having a second wave, a lot of the ad hoc isolation centers are closed. And the few health facilities, as in public health facilities, which were empowered then, cannot cope with the current surge. So if a lot more had been spent in building the capacity of those centers, and it's beyond oxygen, you could have oxygen, but then you could have patients that need ventilators. So it's one thing to have oxygen, it's another thing to have ventilators available. And then when you have that, you also need the manpower, you need the resources, you need the supportive environment as a whole to keep all of those things. And those are some gaps that unfortunately still exist within our health system. But I'm hoping that this second wave will be an opportunity to address them, not only because of COVID, but also for future epidemics or pandemics as may arise from time to time.
Prof, I want to assume, and I hope I'm correct, that you've been following all the recent talk about getting vaccines into Nigeria and how those vaccines will be administered. What's your assessment of the rhetoric that is coming from either the National Primary Healthcare Development Agency or the Presidential Task Force with regard to vaccines? Do we even have enough syringes? Do you have any information whether we have cold chain storage facilities that will be able to handle it? Are you aware of any plan identifying vaccination centers, units across the country? What do you think needs to be done if we're to get that vaccination program right?
Okay. I wish we could step a few months back, and I'll start from when South Africa opted to be part of the vaccine trial. Unfortunately, as a country, we did not participate in vaccine trials, which would have been of benefit not just to us, but to the world at large. And I'm hoping that moving forward, our country would be much more ready to take part in these trials, so that we actually can answer a lot of the questions that is coming up. I've listened to a lot of those discussions from various angles, from the point of government, from the point of the people, from the point of concerned citizens within the country and abroad. And a lot of those are, the concerns are pertinent. They are well justified. Now, I haven't been in the discussions about what government is doing regarding the vaccine, but I want to believe that they've done some research, they've done some homework regarding it. Now, the vaccine being brought in is a vaccine that requires minus 70 degrees storage. The normal vaccines that are used, like the childhood immunization vaccines, are usually at refrigerator or minus 20, not minus 70. So, but I believe that government is taking that into consideration. Maybe they're going to bring in freezers to take care of this, of the storage of the vaccine at these temperatures. The other thing that I think it's important also for government to look at is the willingness of the people to accept the vaccine, because it will be a shame to invest so much in procurement of vaccines that people might not be willing to take. And that will be a lodge of huge resources which the country cannot afford. So there's the cost-benefit aspect of it. Definitely vaccination is beneficial. Vaccination is protective. It's the best protection that could happen for any disease. But you also want to look at this point in the country, what is the cost and what is the benefit? Looking at the 200 million Nigerians, there's a need to do some cost-benefit analysis. Also, the vaccine we are talking about is not a single-dose vaccine. It's a vaccine that has to be given at 2 doses to provide the efficacy that has been proven. So if we say, for example, we're buying 100,000 vaccines, that's actually probably just for 50,000 people, because they need to take one and then they need to take the second dose. And that's one. So the other thing is, so how do you select the 50,000? That's another thing that has to be thought about. Who will be within the 50,000? What are the criteria for those that will be vaccinated? But even before that, how acceptable will this vaccine be to the people? Yesterday, I know that the NPHCDA held a Zoom meeting, trying to get the opinions of people regarding vaccination. Yes, but of course, that is the opinion of Nigerians who understand how to use Zoom. But what about the common man on the street who doesn't have access to internet, who doesn't have access to Zoom facilities? How do you get their impression? How do you get what they think? How do you get what the fears are? How do you reach out to them and then to pass across the benefit of the vaccine? The other thing government has to do, because in recent times, there has been a lot of mistrust in government by the people. Our government needs to really work hard on gaining the trust of Nigerians, especially when it relates to health matters and especially to money that has to be spent on COVID. There's still a lot of backlash on the 3.5 trillion that was spent because people do not know what it was spent on. So government could actually come out and be a bit accountable to the people that, look, we did this. And I think that might help people to begin to listen a bit more and to respond more positively to things that government is bringing across regarding the control of COVID-19.
And I like the fact that, you are retrospective for us to have a plan going forward and thinking about how we've gotten here so far. And I'd like to ask you about the national response. So much is talked about a national response to the pandemic. Do you think it was a mistake to think that the state government would take responsibility of response to this epidemic in the country? Was that a mistake on the part of the national response strategy? And is there something we can do differently? And I also like to ask you about the second wave and the first wave. As at yet, Nigeria is yet to identify a new variant as the cause of the new infections we are seeing. Genome sequencing is ongoing. But what does your professional gut instinct tell you about this increase we are witnessing?
Okay, you've rolled two questions into one.
Yes, I have.
So let me start with the first question. Okay, let me start with the first question. It's not wrong to say that states should respond, because health is on the concurrent list in our country, and states are actually they are responsible for the health of the people within their jurisdiction. So it wasn't a wrong thing to say that states should take charge. I think what state governments need to understand now is what it means when you say health is on the concurrent list. And they need to understand that they are actually ultimately responsible for the health of the people within their states. Lagos State, Ogun State, Kaduna State, there are probably a few other states too. They have taken this challenge very seriously, and they have stepped up to that responsibility. In another light, Kogi State too has taken its own responsibility in its own way. I think what we need to look at is how does the national provide oversight to the states, so that even when the states are taking responsibility regarding the health matters and health issues within their state, they're doing what is right and they're doing what is evidence-based. So, and if you say every time there is an epidemic, the national needs to go out and do that, it's not a sustainable way of addressing health matters. But there are times, of course, when the national needs to step in to provide a necessary support. And that's actually how global health security issues go, whether at the local level, whether at the state level, whether at the national level, or at the global level. People have an adage that it's when a child lifts up his or her hands that the child gets carried. So states really need to step up and do what they need to do. But of course, national provides the guidance, provides the policies, and provides the necessary oversight in this aspect. Now, coming to your second question on the variant, We don't have that evidence yet. So, and for me, I like as much as possible to work with evidence. So we don't have the evidence that probably it's a new variant, especially when we know that a lot of people, as soon as the numbers started coming down, people threw every caution to the wind. People went back to life as it is. This Christmas, there was this video circulating about a beach in Lagos, you know, where people have thrown all caution to the wind. And it wasn't even only in Lagos. People went to their villages. I had one of my classmates who called me from the village and said, you know what, Bola, I was the only person in the whole cathedral who wore a mask today in church. So there's a lot of carelessness and carefree attitude going on. That alone is enough to actually increase transmission, irrespective of whether we have a new variant or the other. But I'm sure by the time they complete the sequencing, we'll find out whether we have a variant that is more transmissible, or it's just a change in attitude that will help us to deal with the second wave.
Prof, I just want to get your peer review on this. So there's been this school of thought bandied around by a couple of professors saying that people should do an antibody test before they take the vaccines. Professor Sunday was here. Omilabu was here the other day. And there's also a Professor Rosemary Aldu that has also been, you know, pushing that line of thought that, oh, most Nigerians have some level of immunity already, natural immunity, that we should only, it is only those that if they take the vaccine and it can disrupt the immunity they have already, so they should do an antibody test before they take the vaccine. What's your school of thought on this?
Okay, from the evidence we have from countries that had followed up people who tested positive, they found out that after about a month of being infected, the antibody levels begin to wane, they begin to go down. And usually about 3 months after being infected, there are virtually no protective antibodies again within people. And that's why you find out that some people had been infected the first time, and then they got infected the second time. So I do not think there needs to be a lot of emphasis on whether somebody has been infected before or not, because being infected before does not prevent you from being infected a second time. So really, if the vaccine is going to be effective, it will be a good one. We also do not have the information yet on how long the current vaccine may be effective for. So that's another caveat to the vaccine. How long would it offer protection for? Is it a vaccine that needs to be taken every year? Is it going to be one that needs to be taken every 6 months? That is being studied, and we don't have that evidence yet. So from my own angle, I wouldn't put too much emphasis on whether people need to have an antibody test or not before vaccination.
Thank you very much, Professor Olayinka. Thank you for joining us on The Morning Show.